Arthroscopy is a very minimally invasive surgical procedure that involves the use of a small arthroscope which will enter the temporomandibular joint. It is a mix of a lot of surrounding structures which can lead to symptoms like jaw pain, limited jaw movement, clicking and popping of the joint, as well as further on when these problems are ignored, they may go and take shape of an headache. uh, Migraine is being the most what do you say convenient diagnosis that most of the patients with TMJ have, and most of these patients have already been to an ENT. However, today you ask me this question, whether what is the relevance of arthroscopy, TMJ arthroscopy in temporomandibular joint disorders. Firstly, I would say that since it is minimally invasive and there is very little damage and downtime for the patient, it proves as an excellent diagnostic tool. So let me put it right out there. Most of the times, the MRIs that we perform do not give us a complete idea of what is happening inside the joint. These MRIs technically miss out on a few key aspects which are necessary for a clinician slash surgeon to take the due treatment, go through the accurate treatment planning. So arthroscopy will obviously allow a direct visualizations of these structures within the TMJ and will help identify a specific cause, whatever is going aspect of TMJ arthroscopy. If you were to ask, I would say it is an absolutely therapeutic procedure. Now, most of the times we are asked that, okay, you performed an TMJ arthroscopy, does it stay that way? I mean, the surgeon went inside, performed an arthroscopy, got the disc back in position. Will it remain there? Yes, it will remain there if due protocols and post-operative orders are followed from the patient. And then yes, there are a few lifestyle modifications that the patient has to do, which come along with any joint procedure that you perform. Having said that, yes, it is therapeutic. We perform proper myotomies. Yes, look, you have to understand that the procedure needs to be performed in an ideal manner to achieve those kind of results. But once done in the apt manner, it does deserve credit. What I mean, deserve credit means the procedure deserves credit. It does the job. It gets the disc back in position, and I feel out there is a very little amount of credit given to the disc condyle relationship. I mean, I've heard a lot of debates over this concept, but I personally feel that if the disc is not in the right position, no matter what you do outside at the occlusal level or the muscular level, things will go back to how they were. You should give more respect to the disc condyle relationship. And also, I would like to point out that we are currently performing a study over here with a lot of our patients. Study in the sense not experimenting of any sort. It is just looking and following up with them for a period of 2 years. And what we have seen is timing when you intervene in an TMD also matters. When the problem becomes more chronic, it's been there with the patient for more than 5 years. Now it is really difficult to manage this patient, because now this patient has now converted into a full-blown case of orofacial pain, where multiple symptoms, pain causes are overlapping each other. So I think yes, this also plays a very important role. That's the timing of when you are planning to intervene. And I would also like to say via your platform that as and when these things are coming forward, it's not like these problems never existed before. They were always there. It is just that awareness. Patients should realize what is happening and where it is happening. So yeah, this is all for the sake of awareness, and thank you for helping us out.